Good evening, everyone. Thank you for joining us for our advocacy webinar. For those of you that don't know me, my name is Shannon Cloud, and I am Patient Advocacy Director for DSF. And along with me tonight is Gloria Rodriguez, who is also on the DSF team. So we are here to share a little bit with you about advocacy in general, how DSF is involved in advocacy, as well as how as you personally can take that step and get involved in advocacy if you would like to. If anybody has any questions, feel free to jump in and ask. Otherwise, we'll definitely have time at the end to go through questions and talk about everything that we've gone over. So the first thing I want to point out is the mission statement for DSF. You'll see there in the purple letters, increase awareness. That is a big part of what we are doing with DSF. When DSF was founded in 2009, the intent was really to focus on research, and that means raising the funds for the research. But obviously awareness is a big part of the mission as well, because the more people we educate and teach about Dravet syndrome, the better chance we have of getting the attention we need to hopefully ultimately find a cure. So spreading awareness, I think we all do a good bit of this already, whether it's wearing DSF merchandise, so that people may ask us, hey, what's Dravet syndrome? I assume most of you are probably familiar that on the DSF website, there are some brochures and educational materials out there that are available that you can download as a PDF. So if you want to take a flyer about Dravet syndrome to your local fire station, maybe so that they know about your child when they're responding to your calls, or if you want to share something with your child's teachers at school, those materials are out there. If there's anything you see out there that would be helpful to you that you would like to have an actual physical copy of, just let me or anybody on the DSF staff know, and we could definitely get those mailed out to you so that you could hand them out to people. We have patient and now caregiver stories that are on the DSF website. So the patient stories have been there for a while, not fully utilized. We really need to get more people to submit them. But just recently we added caregiver stories because we feel like it is important to tell the story about what we are dealing with as caregivers and what that life is like. So we will be asking more people to submit those in the coming months. And so having those linked on the website is a great way to have the ability to easily share with someone and tell them about your journey without you having to like type something up or talk about it. It's already, you've done it, it's there, and you can easily share it with other people. Attending events, whether virtual, you're posting it on Facebook, or whether going in person and inviting friends to join you, is another great way to spread awareness. And then, as we all know, social media is kind of at the forefront of our minds. It's a very easy way to share a lot of information. I think for the most part, a lot of us just rely on that private Facebook support group. But if you don't already, be sure to follow the DSF public social media, because we do share a lot of things there that don't necessarily get posted in the support group. One of the things that we do on a fairly regular basis is share a Dravet fact. And so those are some of our most engaging posts, honestly, because people in our community will share those so that their own networks see those to try to understand the things about Dravet syndrome that the average person may not realize are a part of our journey and things that make life difficult. So yeah, social media is just a great way to, whether you create your own post to talk about something that happened with your child, or whether you just share something directly from DSF, it's just a great way to get the message out about Dravet syndrome. We all have a story, right? Whether we've been doing this for 19 years for me, even more for at least one parent on this call, or whether it's only been 6 months, right? We all have things that we've gone through, and that's a part of our journey. And so sometimes those things can be painful to talk about, but it's important that we do talk about them, whether it's talking to a friend or family member or a teacher, or whether it's, you know, going to a legislator and talking to them. That story is the main piece that is important for you to share, because it's your personal experience and it's what helps people to really understand what you're going through, what kinds of things you need to make your life easier for you or your child. So yeah, there's some information, there's some links here, and I'll share this presentation after, that can give you some tips about how to share your story if that's something that you're not comfortable with. So from awareness to advocacy, right? I think most of us are involved in awareness because we want people to know about Dravet syndrome. And in reality, we're all advocates already, whether we realize it or not, because for pretty much everything that our children need, we have to fight for. So, whether it's school or whether it's, insurance approvals and things like that, we are all advocates. It's just a matter of what we're doing because we have to, or if we want to take the step to do even more advocating. So, like I said, here's examples of ways that a lot of people in our community are already advocating, like it or not. Um, Also, is like, if something at your doctor's office isn't right, or the hospital you go to, you might have to fight them on some policy they have that's making your life difficult when you're admitted to the hospital. Um, like a local business. Say there's some establishment that you go to that doesn't have accessibility, and you can't easily get your child in their wheelchair or stroller into that business. There's local things, and then the obvious is state and federal issues, which is what you really think of in terms of legislative advocacy. So we have a lot of people in our community that are very involved in advocacy already. So these are just a few examples. There are many states that have had legislation for seizure-safe schools. And you'll see in that first picture there is Casey Capps and her family at the bill signing for Will's Law in Missouri. And that was actually named after her son, Will. We have several other families that have been involved in that type of legislation in their states as well. There are many of us that have fought for medical cannabis in our states over the last 10 years or so. And you'll see the picture in the middle is Amanda Hauser when the medical cannabis bill was signed in New York. That was a long time ago because she's all grown up now. But we had several people from our team participate in Rare Disease Week in Washington, D.C. last week, and we've had other people go to D.C. for other events as well. So those are just a few examples of some of the things that we know about that people in our community are doing, but I'm quite confident that there's a lot of people out there that are advocating for other issues in their states as well. Um, this slide just has a little bit of information. That first list is just about some of the resources that are out there, some of the things that we have to learn about as parents when we're advocating for our kids, whether it's IEPs or learning about Medicaid and Social Security and all that kind of stuff. There's just a lot to learn that we have to get familiar with so that we can fight for those resources for our kids. I do want to highlight some of the different organizations that DSF partners with. There are quite a few epilepsy groups out there. Most of you are probably familiar with Epilepsy Foundation or Epilepsy Alliance America. Those are kind of the two main organizations that, most any state that you live in is going to have one of those organizations that's available to people in your area. And they can be great resources for epilepsy specific things. And then there are some other groups that DSF works with a lot, Epilepsy's Action Network and Rare Epilepsy Network, as well as the American Epilepsy Society. So these groups all have meetings on a regular basis. And so we have DSF staff that stay plugged into what kinds of initiatives they're working on so that we can make sure that our voice is heard. As we know, Dravet syndrome is not just your average epilepsy, right? Our kids struggle a lot more, and it's a lot more than just seizures for most of us. So it's really important that DSF takes an active role with those organizations so that we can be the voice for our community to show the kinds of problems that we're facing that aren't just about seizures. There are some rare disease groups out there that we are a part of. The two that I've listed here, Every Life Foundation, and they have an arm within their organization called Rare Disease Legislative Advocates. That's a group I'll be talking about a little bit more in the future. That's who we went to DC with last year, and they are just a really great champion for all rare diseases. And then Global Genes is another group out there that focuses on rare diseases as well. There are other patient advocacy organizations out there too that encompass more than just epilepsy or rare diseases. So DSF has recently gotten involved with the American Brain Coalition. They're a very impactful organization that does a lot with legislation and activism at the federal level in Washington, D.C. And think about, the brain is a lot more than just epilepsy and seizures, right? They're fighting for brain tumors and Parkinson's and MS. And, there's a whole lot of things that are on their radar as a brain organization that's focused on all conditions that impact the brain. Alliance for Regenerative Medicine. This is one that DSF just recently got involved in. In July, I went to DC for one of their events along with Marianne Meskis and Veronica Hood. And this organization is focused completely on like gene therapy and what's to come with that. So it's great that we are partnered up with them because they're really in the loop with what's happening in terms of these treatments being developed, getting them through the FDA approval process, ensuring that insurance companies will ultimately cover them when they become available. So we're very excited to be a part of that group. And then I've listed a few others here too: the Reagan-Udall Foundation, the Rosalind Carter Institute for Caregivers, All Copays Count Coalition. There's a whole lot of others as well, but I just wanted to highlight a few of those. And then within your local state, there's usually, most states have a parent-to-parent chapter, or maybe the ARC is another one that has a lot of local chapters. There may be others that are specific just to your state. So often if you're having issues in your state with a specific issue, whether it's Medicaid approval or something with the schools, or trying to figure out how to file for guardianship, there are usually local organizations like those that are available to help. They may have people on staff that can answer specific questions. They often will have webinars on their website that will explain things to you, so that you don't feel like you're so alone, and you have people to help you figure out the ins and outs of what you need to do. So, all right, this is basic government overview. So I apologize for those of you that remember your middle school and high school government classes and know these things, but I know for a lot of us, we learn these things when we're growing up, and then you become an adult and you may go and vote, whatever, you may not vote, but you don't really think about the people that represent you and who they are and where they come from and how they represent you. So this is kind of just a very basic overview, starting more granular at the most local level would be the schools. So ultimately, you think if you have an issue at school, you reach out to the school, right? You hope they get it resolved. Often that doesn't happen. You may need to go advocate for something at a higher level. So best thing to do, reach out to your school board representative. Maybe email all the school board representatives, maybe include the superintendent. Think of the superintendent as basically like the president, and then the school board is the people that represent you. And oftentimes when you're not getting the response that you need, sometimes all it takes is going in front of the school board and getting some attention on an issue, and then things might happen because you've taken the issue outside of the school and get other people to understand the problems that our children are facing, and then maybe somebody will care enough to take action. Similarly, the mayor, city council for your city, and whatever the setup is for a county or a parish, depending on where you live. And this is one of those things, cities don't typically have legislation, or like they may have some laws, but for the most part, it's your state that determines how things work where you live. But there are times when there may be something that your city can improve to help you. One of the things that just this past year, I reached out to my city because my daughter had a seizure at school, and it took the ambulance 30 minutes to get there. The fire department got there really quick because they're right around the corner. They immediately called for the ambulance, and it took 30 minutes because there was not one nearby. Well, the very first thing I did when I got home that night was sat down and sent an email to the city council representative that represents the district that the school is in, the one that represents me where I live in my city, and copied the mayor, because the city is who has the contract with the ambulance company. If that ambulance company is not upholding their end of the deal and serving the community in the way that they should, then the people with the city need to know that, right? And they ended up getting in touch with the ambulance company and talking to them and stuff. So it's really important, you know, whether it's a law, it doesn't have to be a law something, but there are things that those people can get involved in if you're having any particular issue. So moving on now to state and federal, this is more what you think of in terms of legislation and making laws. So at the state level, you typically are going to have one state representative in the House and then one senator in the Senate. Different states call those different things. I know some places they're called delegates, like there's different names for it, but that's basically the structure, is that there's the House and the Senate, and you would have one representative from each. I made the note here that because there are less senators, it may be harder to get in touch with a senator or get more attention out of them because their districts are larger. So you may have better luck going to your member of the House, the representative for that, because they're more likely to be more in tune with your local community and be a part of your area and be someone that you could reach out to and potentially even meet with in person, because they know more about what's going on in your community. And then on the federal level, it's same setup. You have one representative in the House. There are 435 seats in the U.S. House of Representatives, and so they get divvied up based on the population of the state. So for me here in Georgia, I think we have 13 or 14 members of the House. You know, you big states like California, Texas, Florida have way more than that, and then there's some tiny states that only have one. And then the Senate, this is where it's different at the federal level, is that there are 2 senators for each state, and they represent the entire state. And so the U.S. Senate has 100 members in it. Each state has 2 that are there. So every state has equal representation in the Senate. So if there's an issue or you have some kind of a concern that you want to reach out to legislators about, there are several ways that you can do that. Most of them, they're going to have a website, either as a part of, you know, their official government job, whether it's a state website for your state legislators or federal, like congress.gov, or I think it's House, whatever, where you can look and they have their official website that has their contact information, all their staff members' emails and contact information. So you can always go to the website and fill out, like most of them are going to have a standard contact form. Some of them may also have websites that are kind of like their campaign websites. And so that's not a bad place to go either. There might be more chance that they actually see it there rather than staff. Even if it's just a staff member that responds, it's still a great thing to make your requests known, because they are keeping track of when people fill out forms on their website about particular issues. Like I said, you can find their email addresses on those websites. Typically, if you send an email directly to the member, whether it's state legislature or whether it's in Congress, more than likely that person is never checking the email. It's their staff members that are doing it. But again, they keep track of the messages that they get on a particular issue, whether people are for it or against it. And so emailing is still great. The other thing I would suggest is, if you're emailing them, you can also look at their website and find out who some of their staff are and email those people directly also, because they're the ones that are paying attention. And particularly if you're talking about contacting one of your federal legislators, most of the things that we would be interested in probably fall under like healthcare or whatever. So you can look on their website and you can see what staff member is responsible for healthcare policy. Send it to that person, because that's their job, is to dig into any potential legislation and these issues around healthcare. So if you send something directly to them, that may actually have more impact than emailing the actual legislator directly. You can always call. Most legislators will have an office in the Capitol, as well as they have one in their home district. So you could call either of those. Just keep in mind that if you make that phone call, more than likely you're going to be talking to probably a very junior staff member. And so that phone call may have less impact than an email, which can get forwarded and which allows you the time to actually share your story and give them more information. A phone call is going to be a pretty quick exchange, more than likely, with whoever answers the phone. You can always ask to have a meeting if you would like to meet with the member or someone on their staff. More than likely, it's going to be a staff member, and probably one that's pretty low on the totem pole. but those meetings can be a real way, even if you're not meeting with the actual legislator, the way to get to them is through their staff. And you never know when you may end up meeting with a staff member who knows somebody who has a child with epilepsy or has some impact or some connection. And if you form that connection with them, they take that back to their boss and say, hey, I met with this family from our district, and guess what I learned about them? This is what we can do to help them. So don't be too discouraged if you ever had a meeting specifically with someone that's on the staff and you feel like that is not impactful, because it really can be. And then another way where you sometimes can get some attention is on social media. So most of these legislators are going to have a public social media profile out there. You may not agree with them on every issue. Obviously, we live in a very divisive world right now. And a lot of us, may not feel like our representatives necessarily represent all of our best interests. But if you see them posting about something, whether you agree or don't agree, go out there and comment on it. It doesn't hurt to put something out there and get attention. And, you may get their attention, or their staff's attention. You may get attention from other people in your district that didn't realize that's something that was an issue for our community. So don't be afraid to do that and use that as a means. You could get yourself blocked by their social media too. If they don't like the things that you're commenting, they very well may block you because they don't want you calling them out on these things. But keep in mind that social media can be very effective. And then another thing is, a lot of legislators will do town hall meetings either in person, or they may set up virtual town hall type things where you can submit questions and things like that. So even if you don't have a specific question or don't feel comfortable asking a question, still attending something like that can allow you to learn a little more, and potentially you'll get to have a conversation with somebody that could be impactful. These are just some ways that, if you are interested in getting more involved with advocacy, these are some things that are out there that you could be a part of. The Seizure Safe Schools Initiative, this is something that Epilepsy Foundation and some other organizations have been really pushing for. So if you want to see if your state has a law on the books, the Epilepsy Foundation website has a list of those. I can't remember. I want to say maybe half of the states have it now. I'm really not sure. I know that there are efforts still going on in some states to get that law passed. That's something that, this legislation really just, it's basically just putting rules in place that require school districts to do certain things. That if there's a child with epilepsy in their school district, they have to make sure that the staff are trained properly. And that just, every state law is going to be different, but there are just certain protocols that are put in place to ensure that kids with seizures are going to be safe in schools. So, if this is something that your state doesn't have and you would like to get involved, certainly reach out to me, reach out to one of these organizations that's in your state, see how you can be a part of it. It doesn't mean that you have to, show up and speak at a hearing or something like that. It could be just as simple as you sending an email to either your own legislators from your district or the legislators that are on the committee that ultimately is going to decide this bill. It could just be a simple email saying, hey, this, I want to tell you about my child, and I want to tell you why this legislation is important to my family. Attending advocacy events. So a lot of organizations will put on an advocacy event like at the Capitol, again, whether this is at the state or whether this is the federal level. You may think that if you show up to an event like that, well, I didn't speak, or I really didn't talk to anybody, I don't feel like I made an impact. Sometimes just there's strength in numbers, right? Like, even if you didn't make a personal connection and feel like you made a difference, if there's some kind of advocacy event happening, say at a state capitol, the legislators know and they realize, wow, a lot of people came out to support this. This must be important to a lot of people. Maybe this is something we should take seriously. So it doesn't mean that you have to take an active role. Sometimes just showing up and being there is enough to make a huge difference. A couple of the events that DSF has participated in and will continue are Rare Disease Week on Capitol Hill is something that we did last February with the Every Life Foundation, and we are doing that again this February. And we are hoping that we will be able to get some advocacy funding so that we can have a few other members of the community join us this time. So if that's something that any of you are interested in, please reach out and let me know, because we really would like to get more people involved in that. And then Rare Across America is also from Every Life, but it's a virtual event that takes place in August. Something that some people in our community have done is reach out to their city and ask for a proclamation just acknowledging Dravet Awareness Day on June 23rd. So, I mean, that can be a great way to get information out there. Again, you might feel like it's not a huge impact, but say you do that for the small town you live in, they put a post on their social media saying, hey, today is Dravet Syndrome Awareness Day, and they tell a little bit about Dravet syndrome. That right there could be impactful in your community. And then the big thing that we all think about in terms of legislative advocacy is, actually reaching out to a legislator about a specific bill and saying, hey, I want you to support this, or I want you to join a caucus, which is something I will talk about in just a second. And as it says here, and much, much more, right? There are a lot of ways that we can be involved in things. These are just a few examples of some of the things that we know are kind of easy for our community to take part in. So focusing on federal advocacy now. So congressional caucuses. That's basically when a group of people in Congress, both Republicans and Democrats, get together and join forces for some specific issue or cause, or I mean, literally, there are caucuses literally for everything. There are hundreds of caucuses out there for everything under the sun. There's a rare disease caucus that started in 2010. That one's been around for a while. And then there was an epilepsy caucus launched just earlier this year, first with the House and now with the Senate. And so the idea behind the epilepsy caucus is that is a group of legislators that have expressed that they have support for patients with epilepsy, and when there's legislation that can impact our community or things that they can do, we can get them involved to help fight for those things on our behalf. So that's a real easy ask, to reach out to your House member as well as the senators, and just a simple email and say, hey, this is my child with epilepsy, talk a little bit about it, and say, I would love it if you would be interested in joining the epilepsy caucus. So there's endless amounts of legislation pending in Congress right now, most of which will never see the light of day. And keeping in mind that we're about to have one legislative term end, and they're all the House members at least are getting reelected. So a new session starts again in January. So even any legislation that's out there now, if it doesn't pass, it will have to be reintroduced in the next year. So I just want to highlight a few bills that are out there. A couple of these actually have a good bit of traction lately, and the hope is that right now Congress is on recess. The hope is that when they come back after the election, hopefully they're not fighting about the election, and actually decide to spend a little time here at the end of the year getting things done. If they do, we're hoping that a couple of these things will get some attention. The first one is called Accelerating Kids Access to Care Act. It actually just passed the House, and at this point needs to go to the Senate after that. And so what this bill would do is make it so that if you have Medicaid in your state, you would have the ability to be seen by a provider in another state and have them actually accept your Medicaid, and have it be a pretty seamless process, because there will be an infrastructure put in place to allow that. So I feel like this is something that's pretty important to our community, because a lot of us do like to travel and see a Dravet specialist in another state. And obviously, if Medicaid is our only insurance and we go to another state and they can't accept our Medicaid, we're having to pay a lot of money out of pocket, in addition to travel and whatever else, even to get to the appointment. So this seems like something that would be a big win for our community, because it would allow people to use their Medicaid and see providers in other states. The Safe Step Act. So I think most of us at one time or another have probably experienced where you see your neurologist and you come up with a plan for, we're going to go try this new medication that we've never tried before. You get the prescription from the doctor, they send it to the pharmacy. Insurance rejects it and says, nope, you can't try that medication until you have tried this and this. You have to have, it's the fail first methodology. A lot of times it's called step therapy, meaning, nope, there's this step, you have to try this. And if that doesn't work, you try this. And if that doesn't work, then we'll let you try this newer expensive medication. That's obviously frustrating for us as parents, because if a doctor says that we should be on this medication, we should be able to get it. We shouldn't have the insurance company telling us that we're not allowed to try that. So I don't know the status of this one at the moment. I don't think it's one that's expected to go anywhere yet this fall, but this definitely will be one brought back up again next year, because this is an issue not just in our community, but anybody that has medications they want to try that are newer and expensive, and the insurance companies are doing everything they can to put off having to pay for them. The Creating Hope Reauthorization Act. So this one, it's kind of a complicated one. There is a program that's out there now called the Rare Pediatric Priority Review Voucher. This program's been around for, I think, maybe close to 15 years. What it does is it allows a drug company to apply for this voucher so that they can get through the FDA approval process faster. It's basically a fast track kind of thing. And the idea is that it's for a rare disease that has a high impact on a pediatric population. And so the thinking behind it is, there are kids that are out there struggling. They need access to new treatments quickly. So it allows these companies to get this voucher so that they can speed up the process. The companies have to pay a lot of money, like millions and millions of dollars, to get this voucher. But obviously, if it ends up resulting in faster approval, it's worth it to them, because then they save the money that they would have spent in all that development and approval time. So this is an existing program that has been out there, but it was set to end on September 30th of this year. So when we were there earlier this year, there was a lot of urgency to get this passed. Unfortunately, it has not passed. However, Congress did do like a temporary extension of it, I think until like December 20th, so that the companies that have those vouchers can continue to use them. And then the hope is that this one also is something that will get taken up when they get back from their recess after the election. This may seem like something that doesn't really impact our community, but it could. I know that at least one medication, I think it might have been Epidiolex, that GW Pharmaceuticals, I think, may have gotten this voucher to speed up their process. I'm not sure about that, but I think it was them. And think of it this way. I mean, this is a program that if these vouchers are available, it could be something that either Stoke Therapeutics or Encoded, who are working on the genetic therapy treatments, if they're able to get this voucher and that could potentially speed up the approval, then that would be a huge win for our community. So that's why this legislation is important to us. It may not impact us, but if there's anything out there that can get medications approved faster for the rare diseases, then that's a good thing. And then this Help Copays Act. So this is a complicated one to explain. I'll use my own personal example to do it, because otherwise I would not know what a copay accumulator is and why we would want them banned. Many of us have medications that we get, and there's a copay assistance program from the manufacturer. And we end up, it depends what state you live in. For me in Georgia, copay accumulators are banned. They're not allowed. And so that money that the pharmaceutical company or whoever is putting towards my insurance on my behalf for copay assistance is counting towards my deductible. What is happening in other states where they have these copay accumulators is they're keeping track of how much these companies have paid in copay assistance on your behalf, and they're not counting it towards your deductible, and then you're having to still meet your deductible as if none of that had happened. And I never really understood that until recently, because I felt like, well, I'm not paying it, right? So why should I have to pay? Why should I get out of paying my deductible when I actually didn't pay anything for the medication, yet I'm showing as if I met my deductible? Then I understood a little more that the problem is the insurance companies are getting the money from that company for the copay assistance. You're not paying it, but somebody's paying it. And then they're still making you pay your deductible. When in reality, somebody else already did that for you. And so it's essentially the insurance companies are double dipping and they're getting paid twice. So that's why these copay accumulators have become a hot topic, because a lot of people are realizing, hey, this isn't fair. It's not so much even the impact of the patients, but it's not fair to that the insurance companies are getting to get paid twice. So again, I'm not sure of the current status of that one. I don't think it's expected to go anywhere, but I know there is a lot of support behind this. A lot of states have already, I think close to half the states maybe have bans on copay accumulators, but not all of the states have done that yet. And so the idea is that there needs to be a federal law, and if federal law says that these insurance companies can't do this, then that will stop the practice once and for all. So these are just a few examples of things that are happening at the federal level that benefit our community. There are a lot of there's a lot of legislation out there that could impact us either as a Dravet community or other things that might help your family personally. But we wanted to just highlight a few of these things that that we are keeping an eye on as a DSF and is advocating for. So if any of these are things that are important to you, feel free to you reach out and advocate. Just send that email or fill out that form, and I will explain here in a second how to do that. So one of the easiest ways to reach out to a member of Congress is to submit an action alert from an organization that has these set up. So I've listed here Epilepsy Foundation. They have a page on their website, as well as Every Life Foundation has a page, and they actually have specific action alerts out there where you can, I'm actually going to show you, let me see. If I go to Every Life Foundation, you'll see here they have all of these things listed here. So Creating Hope Reauthorization Act is that priority review voucher one that I mentioned. This is accelerating kids' access to care. Some of these are specific organizations, but the Safe Step Act is one of the ones I talked about too. And so if you are interested in sending a message to a legislator asking them to support it, like you can actually click on this, and all you have to do is enter your information, and it, based on your address, it knows where you are and it will determine who your members of Congress are. And when you submit it, I'm not going to go through the process, but it will pop up a like basically a template with a message that's already written for you. So you don't have to know what to say. You don't have to understand the ins and outs of the bill and feel like, oh, well, if I'm asking for this, I need to explain to them, I need to understand it. I need to know what it is. Using one of these tools will pop up a message that's pre-populated with the information you need to share. Typically, it will also provide a place for you to personalize it a little bit, because what makes the most impact, getting a form letter is not what they care about, right? They want to know what you're asking for, request it clearly, but they also need to know your personal story and why are you asking for this? Why is this so important? So that's Every Life Foundation. Epilepsy Foundation, they have a similar setup here. You'll see the Safe Step Act. This is Seizure Safe Schools in Michigan, which is one of the states that has that going on right now. Washington, D.C. Also, here's a link for asking members of Congress to join the Epilepsy Caucus. And with most of these action alerts, the way that they're set up is that when you click on it, and it populates, who it's going to send it to based on your address. If they're already a member of the Epilepsy Caucus, it knows that, and it's not going to send them a message saying, please join the Epilepsy Caucus. It's actually going to send them a thank you message and say, thank you for joining the Epilepsy Caucus, because this is important to me. And then, you explain why. Likewise, with any of the legislation, what it typically will do is if they are already considered a co-sponsor, like they've signed on to that bill, then it will, same thing. It will be a thank you message. It'll be, thank you so much for supporting this. I hope you'll continue to support this when it comes to the floor for a vote, that kind of thing. The other thing that I meant to add to the presentation, I forgot, is if you ever want to see a specific bill, like I've got the bill numbers referenced. If you want to see, hey, are my members of Congress, are they co-sponsors? Are they on there? It's very easy. So
All the links in the chat for the bills you talked about.
Thank
They're
you.
all in the chat.
So if you just type the name of the bill, either the name, like I typed the wordy name, or the bill number, and you click on it, you'll have the ability to see who the co-sponsors are. So you'll see here it passed the House, which in this day, anything that passes either chamber of Congress is like a miracle. So the fact that anything we're pushing for has actually passed one chamber is really amazing. So you can go to co-sponsors, and you can go here and you can look and see who the co-sponsors are. And like you could go and click, like I'll click on Florida for Alan. You go here and you can see who the representatives from Florida are that signed on to that bill. And so if you see that yours is on there, great, send them a thank you. If you see yours is not, then that's when you want to reach out and ask for their support. And even if they're a co-sponsor on the bill, that just means they signed on initially to support it. That bill still ultimately has to come to the floor for a vote if it hasn't yet. And so they could be signed on as a co-sponsor. You still want them to know that it's important that they actually vote yes when it gets to the floor. Because honestly, they sign up, they co-sponsor things all the time. They may not necessarily even remember when the time comes. And then related bills, well, apparently this is not a good example. Typically what happens here when you click on it, you'll see the Senate version of the bill, or likewise, if you're on a House bill, then you'll see the House one, and then that way you can check them both. So yeah, I mean, for all of the things that I mentioned, I think there's an action alert set up on one of those two websites. That's a good, easy way. If you can't find an action alert and you are interested in reaching out to someone about these things, just let me know. I'm happy to help. Gloria and Austin on our team, we're all available and happy to help you. If you're interested in getting involved in these things and you're just like, I don't really know how to start, just let us know and we will guide you through it as much as you need. There's a lot of things that DSF is involved in that's not even necessarily specifically tied to legislation. So I wanted to mention the FDA Rare Disease Innovation Hub. This is a new initiative that really just got off the ground in the past couple of months. Last week, they held their first meeting to get input from patient organizations and patients about what is important in terms of rare diseases when it comes to getting clinical trials done and getting through the FDA approval process. So the goal of this is really to bring together the different divisions within the FDA that are involved in approving rare disease treatments, because right now there's the Center for Biologics, and then there's a Center for Drugs. And so like all the traditional medications that we have gone through CDER, which is drugs. But now that we're talking about genetic therapies, it's a completely different arm of the FDA, which is the Center for Biologics. And it's really important that all of these people, no matter where they are within the FDA, are on the same page, and that the approval process is happening consistently for every rare disease that's going through these processes and every treatment. So the idea is that this new hub basically gets those people so that they're connecting with each other and talking to each other and on the same page, so that hopefully rare disease treatments can get through the process faster. They held that first meeting last week, and all of the feedback I heard, I watched the meeting online, and hearing from the people who know a lot more than I do after the meeting, everybody was really, really encouraged that the people from the FDA that are responsible for this have their heads and their hearts in the right place and really are committed to make this rare disease hub be effective. So that's exciting. Every year when the budgeting happens in Congress, which of course gets drawn out, right, over and over again, and they do extensions, and a big piece of that is always making sure that the funding that the NIH, National Institutes of Health, gets for epilepsy research is still there, because we need more research. And so we're often signing on to letters from different organizations where they're letting the members of Congress know how important it is that NIH continues to get that funding. And then a lot of us on DSF staff go to conferences throughout the year. Marianne and Veronica just went to a conference in Europe, which was really exciting. I think I mentioned that we went to a cell and gene therapy event in DC earlier this year. Gloria just went to an event in DC a couple weeks ago. And earlier this year, Veronica and I went to a rare disease summit. And these conferences and meetings are really important because it allows us the opportunity to learn more about what's going on in the space and what we can do to get more engaged, but also it gives us the opportunity to connect with the other people that are attending and talk to them about things and spread the word about Dravet syndrome. So it's pretty exciting. It's an exciting time that there's a lot going on and a lot of things for us to be a part of, both as an organization and as individual families. Yeah, so I think I just said that we just went, we've been advocating at a lot of conferences and different things. Some things you may see, and there's a lot going on behind the scenes that DSF is doing that you don't see. So we definitely want any families out there that want to get involved, we want you to get involved. We encourage you to take part in any of the things mentioned in this presentation. If there's something else, an issue that you're having locally in your state or something you see at the federal level that we are not even aware of that you think would be helpful, please reach out to me or anybody on the advocacy staff, and we would love to get you plugged in and figure out how we can work together to get things done for our community. With that, I think the presentation is done. For those of you that were on the call, I will send out the presentation to you afterwards. Gloria, if you want to go ahead and stop the recording, you can.